the an incoming resident. I just recently matched into family medicine, and also I'm part of the board of directors of MOLA, and I'm part of the international health graduate of MOLA. I've been in this position for about 2 years. So without further ado, because we are on time schedule today, I'm gonna share my screen with my presentation about medical and surgical assistant. So let me just show you my screen. Can everybody see my screen?
Yes.
Cool.
Perfectly fine.
So
go ahead.
Awesome. So yeah, so today's webinar is something that we have been doing in the past few years. It's called Beyond USMLE series. Today we're talking about the alternative career path for INGs. INGs stand for International Medical Graduates. So an international medical graduate is a doctor or a physician who complete his medical school outside the United States or Canada. So that's what an ING means. If you are here in the United States, probably you are familiar with these two professionals. So two of them are, one of them is a medical assistant, and the other one that I'll be talking about is a surgical assistant. So I'm going to be covering 5 topics today. The first one is life and work as a medical or surgical assistant, the work opportunities for these professionals, the average compensation, whether you might apply or you might qualify for a visa or no. Lastly, I'll be talking about some websites of interest if you are interested on becoming certified or a registered surgical or medical assistant. How do I delete those lines on my screen?
Somebody did it. That person has
Yeah,
to
right?
Yes, you didn't do it. Somebody did it.
Okay, cool. Okay, well, I'll continue. So the first one that I'll be talking about is medical assistant. So medical assistant is also called a MA. You will refer as a medical as a MA for short. Also as a clinical assistant or a healthcare assistant. So the medical assistant are one of the allied health professionals who support the work of physicians, nurse practitioners, physician assistant, and other healthcare professionals, usually in a clinical setting. They might be certified or registered, depending on what organization you get the certification from. And also, the medical assistant, they perform clinical, routine clinical administrative duties under, and this is important, under the direct supervision of a physician or another healthcare professional. So they cannot work by themselves. They are always under the supervision of a doctor or another healthcare member. So some of the work opportunities for this, they are limitless. There are endless opportunities out there for medical assistant. Pretty much, if you see a doctor's office, there is going to be a medical assistant there. They are like some sort of like a personal assistant, but they also do like clinical duties, like taking vital signs, measuring patients, they call medications, among others. And here is where it comes the role of international medical graduates as a doctors. We are not licensed to prescribe medications, but in certain cases, given your experience or whatever your scope is, you might be allowed to do a little more because you are a doctor already, even though you don't hold a license in the United States. So for example, in my case, I worked as a medical assistant for about 2 years. I was seeing the doctor's patient, I was doing follow-up, I was calling the patient's medications to the pharmacy, among another stuff. Removing stitches, because I feel like my surgery I have some surgical background. So that being said, so there is a shortage of medical assistants. So pretty much you can find a medical assistant in any office, as I said. So if you're looking to apply over a surgical specialty, probably this might be, and you don't work in this, you don't have any experience in the surgical field, this might be a great opportunity for you to work in the United States and also get some good letter recommendations. Let's say, for example, the other day I was talking to someone and she was interested in applying to urology. So I told her about a position in a medical, with a urologist. She will be working as a medical assistant, getting paid, getting the experience, and hopefully getting future LORs that build a network in the future application for the USMLE exam and for the residency application. So next slide. Okay, what's the average compensation for Zurich for medical assistant? So on average, you will be making like $3,700 per year. My experience, this changed a lot. You might go like from $15 to $25 per hour, depending on the experience. What do you do? Where do you work? A lot of factors play in a big role in there. So this is just average. You might be getting even more than this, or maybe less, depending on what you do. A visa, most likely you won't be getting a visa for this type of work. Some websites of interest that I have in here for you. The first one, which is what I got my certification from, you can see it here on this little picture at the bottom. This is the American Register of Medical Assistants, and your certification will look like that. So it will say Registered Medical Assistant, will have your name and your license number and the expiration date. Some other websites of interest is the Solidaridad Sin Fronteras. They are based in Florida, and I think they even have like a course and a training with them to obtain this certification. But for us as a doctors and a foreign trained physicians, you're pretty much with the ARMA. You only need to submit your paperwork, pay the fees, which is like $70 about like 3 years ago. I don't know if they have increased the prices, but it's a really good and doable way to become certified and start working here in the United States. And the other one that I have here at the bottom is the American Association of Medical Assistants. I'm not familiar with this. I'm just giving you this information so you can do your further research, your further due diligence later. Okay, so that's for medical assistants. The other profession that I have in here, which is the one that I'm doing right now, is surgical assistant or surgical first assistant, depending where do you work and where do you get your certification from. In general, surgical assistant is a healthcare professional who provide hands-on assistance to the surgeon during active surgery. So they aid in the exposure, hemostasis, wound closure, and other intraoperative technical carry out a safe operation. And this is always important. As I say, you're always working under the direct supervision as a surgeon of another healthcare professional. You have to comply with the hospital policies and the appropriate laws and regulations. For this position, for this profession, you will need a license. No, I cannot tell in all 50 states, this is the rule, but I'm based in Illinois. And if you want to work with this profession, you will need a license from the state. So the surgical assistant, they can be found working in hospitals, most likely, or in outpatient surgical clinics. I know some of my friends, they work in Florida, especially in those plastic surgery centers. They have more flexibility and they like to do more than I'm allowed to do here. But it's pretty open and it's pretty wide what you can do as long as you are under the supervision as a doctor, because that doctor at the end of the day, that's the doctor's license. So whatever you do, good or bad, that's gonna fall into the doctor's responsibility. The work opportunities for this profession is limited openings. Yeah, there are not that many positions out there because this has a better compensation compared to medical assistant. Especially if you are trying to get into a teaching hospital, one of these big names hospital, they got residents. They got residents for pretty much every specialty. So why would they pay somebody else when they have residents to cover this position? Especially if you will be looking probably at mid-sized hospitals or maybe surgery centers for this type of work, because the big name hospital, they have surgery residents. So those who doesn't have residents, those are the ones who require surgical assistant to be the first hand or the fixed second hand that the surgeon has in the OR. So you pretty much will be working. I don't know if you can see the picture here on the right side. So first on the left, I have that's the surgical technologies, which is another healthcare professional. So that has in Venezuela, they are called instrumentistas. So that's the instrumentista on the left. Here they're called surgical technologies. And on the far end, on the very end, you'll see the surgeon with the bobby or bipolar, or yeah, that one looks like a Bobby, or electrocautery or electrocauterio in Espanol. And probably on his right hand, he may be a surgeon or may be a surgical assistant. And on the left hand, he has a second surgical assistant, maybe, or maybe another surgeon. But you will be either working here on the right hand of the surgeon or the left side of the surgeon, depending on the type of procedure, what are you doing, what are the doctor's, the physician requirements, etc. So that being said, let me go to my next slide. Yeah, I got one more slide for you. And compensation. Yeah, the compensation is really good for surgical assistant. This is average. In average, you can make over $100,000 depending what you do, the type of surgery, what kind of surgery center do you work, your responsibilities. But the average is pretty good. You will be making about $100,000 a year. Some places more, some places less. That all depends, as I say, what you do. Visa, most likely you won't be able to get a visa for this type of work. They are well compensated and it's hard, but talk to an immigration lawyer. I know one of them, so maybe they can give you better advice than I am giving you today. So ways of interest that I have in here. The first one is the one that I got my certification from. Is the American Board of Surgical Assistant, or AXA. So they will give you, once you submit your paperwork, it's about like a $500 application fee. Once that you get that, they will allow you to take a written exam and a hands-up exam. If you pass both, they will give you a certificate. Once you get a certificate, because I'm here in the state of Illinois, I'm required to have a license. So my license looks like this one on the picture. So once you have that license, you can pretty much apply for a job anywhere you want in the state. Another website that I have in here is the National Surgical Assistant Association and the National Register for Surgical Assistant. Those are two other ways that I'll give you the slides and you can do your dealings of them, which one is better, which one applies to you, because each of them have different requirements and application fees as well. So thank you so much. This is all of my presentation. And remember, nothing is impossible. The word Excel says, I am possible. This is me when I match. And on the left side, you have how everything started a couple, maybe like 3 years ago, starting for my step one. So you guys can do it. Thank you so much.
Congratulations, Dr. Adelis. Great presentation, great advice, great insight. So now we're going to open up the floor for questions. We welcome any questions you may have. Please feel free to submit them to the Q&A chat box right at your right, and we will try to address as many questions as possible. As you think of questions, I would like to ask, what do you see, Dr. Arias, is the biggest challenge for international medical graduates in pursuing alternative careers?
One big one is the language barrier. You don't speak English, it's hard for you to get a position in healthcare, especially that first one, coming from outside the United States without any US experience is challenging. And the second one for these two, especially, I would say the visa status. It's hard. I wouldn't say like, no, you won't get a visa because it might be some exceptions. Nothing is black and white here in this world, but it's hard for you if you don't have a green card, or you don't have a work permit for you to get a visa through these type of positions. Talk to an immigration lawyer and see if this is something that works for you.
Okay, I have one important
Yeah, dentist
question
can be
here.
a surgical assistant as well. That's true, Jesus. Yeah, there are some dental offices that they precisely look for dental surgical assistants. That's completely that. That's an actual fan. I think they pay well as well. They're really well paid. They are really well paid professionals as well.
About that question, because it's not the same. I mean, a surgical assistant to work in a OR, in an operating room, like as a general surgery or any kind of surgery. Yes, the dentist can apply for that license, but it's gonna be harder for them to get a job because they usually ask for a doctor because they know the doctor has experience in the OR. For a dentist, you will be able to get a job in a dentist office as a surgical dentist assistant, which is not the same license. It's a different license through a different board, through the dentist board, which is different from the medical board. In some states, the medical board is the one who give you the license, like in Illinois and Texas, in different states, you get the license through the board, through the medical board, which is different than the dentist board. But there is a similar license for dentists also. I just wanted to clarify, it's not the same thing.
Cool. Yeah, that's awesome. I didn't know that. Thank you, Jesus. I see one question here on the the chat. So does having a medical assistant experience help in your residency application, or do program directors don't really consider it relevant? I mean, this is like it's not like a black and white area. Yeah, in my case, yes, they did help me. I got letter of recommendation from the doctors that I work as a medical assistant. So those, in my case, they help. It might be some other people, they might tell that doesn't apply, but when you go to the ERAS application, which is the electronic residency application, and you gonna have work experience. On the work experience, you're gonna feel, I was a medical assistant, for example, if you are applying for surgery in a surgery center, and you got letter recommendations from doctors from that surgery center, that's an incredible opportunity to take advantage of that experience that you have been working, that you've been in close interaction with clinical and in the surgical field. So that will be a great example that, yes, of course, use it.
Okay, our last question is how to be endoscopist assistant. I don't know if you have any information about that, Dr. Arias or Dr.
I have no idea about that, actually. Yeah, that will be an interesting question to talk about.
So there are different certifications and licenses for people who has previous experience on radiology and endoscopy. You can be an endoscopy tech. For that, you have to do you have to take a course and then an exam. It's very easy to get. And they will give you the opportunity because you already are a doctor, and it's gonna be easy for you to get a job. But as an endoscopy tech, it's not that. It's like very similar to medical assistant. If you compare salaries, but they the job that they most do is pretty much cleaning the scopes and preparing the tower for the procedure. And it is nice because you have you get experience to work with gastroenterologists and those kind of doctors if you wanted to pursue that path of doing that. But I wouldn't recommend that for a long-term job, because you cannot advance in that career too much. It's just that you only can be an endoscopy tech.
Yeah. I know some of my friends, she's a radiology, and she became a certified ultrasound tech, which is an amazing position for, I think, if you are a radiology, you will do in ultrasounds. It's a really well compensated profession, and it's a great way for you to be like in the field and getting some hands-on experience. Well, depends what do you want as well. So we have to put all that in a balance.
Exactly. I want to answer another question before going with the next presentation, which is the question is about the house physicians. House physicians is a good opportunity for some people here in Florida, but in order to be a house physician, you need to get your ECFMG certification. You need to pass your step 1, step 2, even your step 3 is a mandatory to take all the step 3 and be an ECFMG certificate physician. So this is a position for those who do not match for some reason, and they can start working in the hospital as a house physician. And pretty much it's like imagine that it's like an intern. It's like an intern year when you were working in the ER or doing some writing notes and consults, history and physical for all the patients that are admitted in the hospital. So it is well paid, but it's you have to go all the way through the process of the ACNFNG certification. Okay.
Thanks for
Yeah.
your advice and your insight, Dr. Guarecuco. I think that we should be moving on right now, and
Yep.
we will have a change. The questions are going to be answered at the end of the webinar, so please stay tuned. Our next panelist is Dr. Jesus Guarecuco. He is a PGY1 resident, general surgery resident in South Florida, and director of Médicos Unidos Venezuela, USA. Welcome, Dr. Jesus. The stage is yours.
Thank you, Miguel. When I was invited to this, the main reason was to try to give my experience as a surgical first assist, because I did this job by about 3 years in Houston. No? But since Adelis already spoke, very wide about surgical first assist, I'm just going to give some advices, then so we can follow. We can continue with the conversation, because we have small time to do this, and I would like you guys to hear Nelson's presentation regarding nursing, because I think there's a lot of questions about that, and we already spoke a little bit about surgical assistants. So what I would say, what I would recommend to you guys, if you have any surgical background, if you are an OB-GYN, if you are a surgeon, if you are an orthopedics, if you have urology or any kind of ophthalmology, any kind of surgical background in your country, I highly encourage you guys to take this, to do this certification. It's very easy, because the only thing that you need is your medical degree. Then you go to the website, which is from the American Board of Surgical Assistants. You pay a fee, the application fee for the exam. They will send you some question banks. You're going to study for the exam, and then you take the exam online. And if you pass the exam, they will send you the certification to your house. Super simple and easy. Okay, the difficult part of this is getting the job. So for this specific type of job, you need one, improve your English skills. You need to speak English. You need to
Sorry to interrupt. Please, everybody, turn off your microphone. Please. Mute your microphones. Cesar, Mr. Cesar.
Daniel Rojas.
mute
Miguel,
the
go ahead and mute them all. Just
Yes, you can
mute
mute them
them all.
Okay, so for you, so for the difficult part of being surgical assistant is to be able to get a job, right? That's the difficult part. So you need to improve your English skills. You need to be you need to know how to do a CV, like a resume, like a curriculum, and you need how to play. You need to know how to play with all the job search apps like LinkedIn or ZipRecruiter, Indeed, all these things. No? And you need to know that you have to apply directly to the hospitals. All these hospitals in their websites, they have a little icon that says like jobs or careers. So you apply, you find there, for example, surgical assistant positions, and you're gonna get a lot of opportunities, and you have to apply. Okay, so it will be easier if you already have the experience in your country, because you can say, yes, I've done this and that. I can close the skin in 15 minutes. I can do this, all the experience. If you don't have experience, if you are just a newly graduate, or you have experience in a clinical setting, in a non-surgical setting, you also can be a surgical first assist, but it will be harder for you to get a job. So I would recommend you to find a job in a hospital that they can kind of guide you and teach you how to be a surgical first assistant. For example, HCH, which is the biggest corporation of hospitals in the United States with more than 200 hospitals, they are those type of hospitals that they like to teach their employees to keep them for a longer time. But what they do is they usually pay a lower rate, a lower hourly rate. If you, for example, you have experience and want to work with a surgical plastic surgeon, you're gonna get paid $50 $1. But if you go to and work and get a job with HCA, they're probably gonna pay you $30 per hour, which is much less. It's less money, but it will give you the opportunity to get experience and then jump in another, in another job. So there's a HCA. Yes. Okay. So about there's a lot of question here. Okay. The other issue is for all these jobs opportunities, of course, you need a working permit. And I know Adele said that we're not here, we're not lawyers or anything, and we're not giving any kind of immigration recommendations, but you need to know in order to apply for a job in the United States, you need to have, it is mandatory to have a working permit. So you can do this with any kind of visa that grant you a working permit of any kind of immigration status. Let's say you can have a green card, asylum, TPS, parole, any kind of working visa, any kind of status that grant you the opportunity to work in the United States. So that you cannot get a job if you don't have a working permit. So that's important to clarify.
Okay, Dr. Jesus, thanks for your insight and your advice. Pretty helpful. I think that we should be, I don't know if you are done or can we move
Yes,
on?
I mean, I can keep talking, but
Okay.
Let's go to the next topic. I think there's a lot of questions. If people have questions, I can answer them on the chat while we can continue with Nelson.
Okay, thanks again, Dr. Jesus Guaricuco. I appreciate it. Our next panelist is Mr. Nelson Hurtado. He's a critical care registered nurse and the president and CEO of AMP Health Services Incorporated. Mr. Nelson, welcome. Thanks for joining us.
Thank you. Yeah, no problem. Thank you so much, guys. So I'll try to do it as quick as possible. Just like Miguel said, I'm a nurse here. I'm originally from Venezuela. I came, early when I was 18, and I founded AMP. So what we are, I'm going to share a couple of things on my screen. First of all, so this is my social media where I give information, educational information, Enfermería en USA. And then this is the one for the company AMP Health Services, and just amphealthservices.com is going to be the website. I'm going to give information about this, but then I want you guys to go, whoever wants more information, to go to the events. And then we're going to have an event in Colombia coming up, April 27, where we're going to talk directly to the doctors. Somebody has their microphone open. Do you guys, Eliana, do you mind muting it? Because it creates background noise. So this event is going to be direct for nurses as well as for doctors. So I'm going to leave my website there, and then I'm just going to leave the events for Colombia, but it's also going to be on a webinar, okay? So I'm going to teach you about nursing real quick, and just give me a second here. I apologize I had to do a mix of presentations in order to get it here ready. So it's in Spanish. I thought I was going to be speaking in Spanish, so it's Spanglish. But, hopefully most people speak Spanish here. So it's going to be the opportunities that you can find through nursing. Like he said, I'm a critical care nurse in CVICU, was a cardiovascular, open heart, and all that stuff. And then one of the questions that many people ask as international doctors, like, why the heck am I going to become a nurse in the United States? Like, why from a doctorate level I want to become a nursing level? And when you are doctors, that you migrate and you see how difficult it is to do the step 1, 2, 3. And then once you accomplish the 3 steps, then you find the reality that was not the hardest part. The hardest part is matching. So I take my hat off to, Jesus and Adelis and all the doctors that are here that have matched, because that is really, really hard. And I just want to let you know that your dreams have not finished. You know, nursing here in the United States, it's completely different, guys. It's something that is not like it is in Venezuela, is not like it is in Colombia. Yes, you're not going to be a doctor. However, you can get to that level of doctorate, and we'll talk about it later. So, you know, what we have become really popular is about the benefits in nursing. In the United States, it gives you financial stability. Why? It's because a nurse here in the United States can make over $100,000 working only 3 days a week. So you got financial stability, you got job security, because there is a huge shortage. Shortage means deficiency. No hay suficientes enfermeros. So there is a lack of nurses in the United States. So you got a job security. It gives you a lot of security. That it doesn't mean that you're going to have your dream job forever, but it means that you're going to find a job that it's well paid, and then you're going to enjoy time with your family. Then you have professional growth, which I'm going to talk a little bit more about it. So what does professional growth means? Most doctors that come to the United States, their goal is to be able to be at the same level that they were before, whether work in the OR and perform some sort of surgeries, or be able to prescribe, be able to diagnose. You can do that as a nurse in the United States. You can become what we call a nurse practitioner. And Jesus, if you don't mind, if people start asking questions, you know, with the terminology like nurse practitioner and stuff like that, you know, or anybody just answering. Nurse practitioner is pretty much a level of independence that in over 22 states, a nurse practitioner can do exactly the same as a family doctor. The family doctor, you know, they diagnose, they prescribe, they treat, they refer. Nurse practitioners can do exactly the same depending on the state. So that is the professional growth. Another famous one is CRNH, which just stands for Certified Registered Nurse Anesthetist. What that is you're literally the anesthesiologist of the OR. So what we know as an anesthesiologist back home, the CRNAs are the ones that actually perform that duty here, meaning you do the sedation, you do the paralyzation, then you do the intubation, you manage the case, then you do the extubation, and then you do the post-anesthesia care, all being a nurse anesthetist. Some hospitals have you be under the anesthesiologist's supervision, which is more administrative. Some of the hospitals don't even have you supervised, because you, by the time you graduate from CRNA school, you have done over 3,000 cases. So you better know what you're doing when you are, you know, putting somebody under anesthesia. And then social appreciation. So nursing here in the US, compared to what it is, at least in Venezuela, the community itself, they appreciate you a lot. And difference between nursing and surgical assistant or medical assistant or all the others, you can actually get the green card through it. I'm not going to talk about great details of the immigration piece of it, but I'm just going to tell you in general that you can literally get your green card through nursing. So some of the levels, so you guys understand, the levels of nursing are LPN, ADN, BSN, Masters, and DNP. So that stands for Licensed Practical Nurse. This is almost outdated. Whatever program you guys find, whatever university that offers this, run. That's worthless. You cannot get the green card through it. You cannot do anything with an LPN. ADN stands for an associate degree, which is like a TSU in Venezuela, which is a technica. Dulce, I'll answer your question why an NP over a PA soon, but basically an NP is independent and a PA is not. So, and you guys can both do the same thing, and a salary in an NP can be way higher than a PA by having your own practice. So they're both great options, but NP has way more independence than a PA as of now. So bachelor's degree, it's what we call as a licensure, licenciatura, which is a bachelor's degree. You can get the green card, guys, from the associate degree. There are a lot of MD to RN programs. MD to RN programs being medical doctor to registered nurse in the United States, in Puerto Rico, and then AMP is bringing the future MD to RN program in Latin America. We're going to be the first one, and we're going to launch it at the end of this year. So something great is coming about that. So bachelor's, then master's, and then DNP. Master's, a master's in nursing, then you get into the level of diagnosing, treating independently in certain states, and then a doctorate is just an extra level of academia that it doesn't really make a difference for masters and DNP in a general aspect. So we have created scholarships throughout AMP. We've given $500,000 to nurses who are already nurses in the process of sponsorship. So we do a scholarship and sponsorship program. I'm going to talk about that later on, and we're going to be implementing some of it as well for when we have the university. So I'm going to switch this old presentation, and I apologize, but it's all completely different. So Salary on average is about $70,000 just working 3 days a week, which is about $5,800 a month. And it could be higher than that. It could be lower. It all depends on the state. It all depends on the position. It all depends on where you want to work. So there is actually a 3.3 million shortage by now, and they were estimating 3.4 by 2026. It's 2023, and we're almost there. And the shortage, guys, doesn't mean that there are no nurses, because the U.S., it's making a lot of nurses. They're making 155,000 every year, but we need about 203, because out of those 155, look at me, I'm a nurse. I'm not working at a hospital. I'm working private entrepreneurship. So that's one nurse less. And like me, there are thousands and thousands of nurses, get the green card and then decide to do something else, whether it's privately or something that, they rather do versus bedside. But however, I always have that plan B. Whatever goes wrong, God forbid, I can always go and have a really well-paid job at a hospital as an ICU nurse. You only work 3 times a week. You can do 12. You do usually 12 hours versus 8 hours. So that's 36 hours, and then you're full time. And then I like to show this example because, usually the weeks start on Sunday. So if you work the end of one week, which is Thursday, Friday, and Saturday, and then the beginning of the other week, and you connect them together, then you got 8 days off. And then you work 3, and then you got 4 days off, and then you work 6 again, and then you got 8 days off. You literally never have to use your vacations if you don't want to. I never did. And what I did is that when I switched from one hospital to another, I would cash it out. I would say, hey, look, I had 200 hours that I never used. They'll pay it to you on a check. So that was a big chunk check that I got every time I moved, because I would play it smart. Because one of the great things about nursing is that most places you get to create your own schedule. I was able to every month just say what days I want to work and what days I don't want to. And 99 out of 100 times I'll get it, because there is such a shortage that they can't afford to say no. They're like, well, sure. And then you'll move it around. So most hospitals, they let you do your own schedule. So, if we do all these numbers, only working 3 days and having 4 days off, it comes out to a total of 209 days that you're free, which is 6.9, it's almost 7 months out of the year that you're off. Yes, it's not continuous, but a lot of you guys who are here in the States, what traveling nursing is. Traveling nursing is like the next level of financials in nursing. Once you become a traveler nurse, you're going to be making anywhere from $2,000 to $13,000 a week. So you can make more than sometimes doctors. Yes, you have to travel a lot, but during COVID, I was getting offers for $13,000 every week. I wouldn't take it because I was leading A&P, and I'm like, damn it. I should have taken it, but I had this project, and therefore I decided to focus on it, and thank God everything is going well. But you can make a lot of money. And I have a lot of friends that they work 6 months out of the year, and then the other 6 months they take them off. So it's great for having time off. Is it easy? No, it's not. But you guys are used to war hospitals, coming from Latin America. You guys did more than you had to do as the doctors. So another question is, are we appreciated as nurses? So there is a famous survey that it's called Gallup. Everything in the US is about survey and taxes. So we're going to fill out a survey at the end of this. So the Gallup surveys are great benchmark they give you validity about something. So the Gallup surveys have done a poll every year, and during actually 21 years now in a row, nursing has been the #1 most trusted and ethical profession in the United States. So that tells you a lot. And this is Gallup. They go on a daily basis and they ask anybody, hey, John, what do you think? Who's most trusted and ethical? A lawyer, a doctor, a pharmacist, a nurse, and a firefighter? And they always say nursing. So during 21 years in a row. So the population itself, they do like us. So look this up, Schedule A, Category EB3. That is the category of the green card that you would be sponsored under. A&P, we started as a very small company that we would then refer you to companies that are sponsor you today. Like Dr. Warakuko mentioned, HCA, it's a large organization. They have over 200 hospitals. We have contracts with HCA, and HCA sponsors part of our nurses. And as of this year, A&P itself is starting to sponsor people. So if you qualify and you have certain profiles, we can then sponsor you and then place you at different hospitals, whether it's with HCA or any other hospital that we may have under our clientele. So what is the timing for the green card? It all depends where you're coming from, but it could be anywhere from 8 months to 24 months. That's a rough average. And before we go into questions, the last step that you can never forget is you guys have to enjoy each step of the process, and you got to enjoy each time you conquer something, because this is not easy. And you taking the hat off and saying, I'm a doctor, I'm willing to do something else to accomplish my goal. It takes a lot of courage. And that is something that I respect a lot. And that's why we're working so hard to help all the medical doctors from any other nation to help them ease into either nursing or any other career. In my arena, we're expert at nursing, so that's what we're trying to do. So questions, I try to speak as fast as possible, guys, I'm sorry.
Thanks, Mr. Hurtado, great presentation. I hope you guys have learned a lot about the RN pathway that as IMGs we may have, okay? I think that the questions are gonna be done at the end of the next presentation. Our next panelist is Dr. Janet Castaño. She's the current MOLA IHG committee co-chair, and also she has a master's in healthcare administration. And she will talk about clinical research as she works as a coordinator in clinical research. So welcome, Dr. Castaño.
Thank you, Miguel. Thank you, everybody, for joining us today here. As Adeli said, and Miguel, this is part of the Beyond USMLE, the series. This is a webinar that we have been wanting to do for a while, because we want to take a chance to give an opportunity for everybody, not just physicians, but everybody who's in healthcare. And because we know that not every physician wants to go through the journey of the Beyond, to take the boards and to take the USMLE. So this is a great opportunity. Today, I'm going to talk to you about the research, which is something that a lot of people is actually wanting to know. Are you guys seeing my, right? Okay.
Yes, we can. Yeah.
Yes.
Oh yeah, are you seeing it? Okay,
Yeah.
so I'm a physician from Colombia. I have a master's in healthcare administration. I'm part of I'm the co-chair of MOLA for the ISG, which stands for International Medical Graduates. International Health Graduates, which includes everybody who is in the healthcare system. So it's not just for international medical graduates. So everybody's welcome. I'm also the Program and Education Committee co-chair for the NALI. And I'm also a member of the board of directors of MOLA, and I've been there before COVID, so it's been quite a while. I feel that to talk about research is good to actually divide it in two, which is you would have to be either, it's different, the pathway is different if you're enabled to work in the US and if you're not. So we're going to talk about briefly of this, and then we'll come back at the end. So if you're able to work in the US, basically you could actually get a position in research to be able to get paid and get a research role. For that, it's either you will be clinical or non-clinical. If you're clinical, then you would get a job directly as a research coordinator, which would enable you to be able to do clinical trials and to be able to see patients in a research setting, which I will talk about a little bit further. And if you're not clinical, meaning that you're still any other profession that you don't have an active license to practice in the US, to be a nurse, an RN, as Nelson just said, you would have to do non-clinical roles, which are very different from one to another. So we have the data entry, research assistant, research technician, research specialist, and research coordinators. I will talk about these because I feel that once people, especially for us as international medical graduates, we want to start looking for a job, we see all these different words and we don't know what they're about, and we don't know whether we would apply for any of those. So we'll talk about a little bit more. And if for some reason you're not able to work in the US because you only have a tourist visa, or you're just not able to legally work here, then there's another route, which would be non-clinical or clinical. If you're non-clinical, we can talk about fellowships, and you could also enter as a PhD. We'll talk about a little bit more of that. And if you're clinical, then we have fellowships, which can be paid and non-paid depending on the site where you want to work at. So one of the first things that when I started at the research world, like I said, is that there's a lot of different concepts that to be in research, you would have to know what they're about in order to be able to talk in an interview or to even start applying. So when they always talk about the PI, it's very important to know that the PI is the person who is the principal investigator. That means that that is the physician who coordinates the whole research. Usually that is the physician who got the grant for the research and who is going to be actually your boss if you're going to work in a research project. So that word PI, or principal investigator, is really important to know. There's different types of studies. I know that as physicians we know, but in the clinical world and in the research world, in the actually employment world, is good to know that if you're non-clinical, you can only do observational studies, meaning that you will not be able to enter a study as the person who's performing it if that person needs to, for instance, in the clinical trials in the place that I work at. I work at Indiana University. I work with the GI and hepatology. We're doing clinical trials where patients are receiving phase 1 treatments and medications that have not been approved yet for the FDA, and we want to know whether it works or not. But the only person who's able to give treatment for that is a person who has a licensure that is active in the US, that meaning that it must be a nurse. So it's important to know what a clinical trial means in order to know that if by the job that you're wanting to apply, anywhere it says that it will be for a clinical trial, you would not be able to do it if you're not if you don't possess an active licensure for that. Now, when it comes to observational studies, meaning that it would not be an intervention, it would not be in the treatment, but it would be types of surveys, quality of life, or even other types of procedures. For in my specific role, let's say for if it has to do with fiber scans, if it has to do with different types of even labs, then you could do it if you have even a medical assistant license. I saw somebody asking about if as a medical assistant you could actually be able to be in research, and I would have to say that yes. As a matter of fact, I am a medical assistant here in the US as well, and that's how I got into this research world, where I saw that they were asking for some medical assistant to do some broad draws and stuff like that, and that's how I got. And then when they saw my application and they saw that I was an international medical graduate, the group that I applied to actually offered me to go a little bit beyond and move further in my like a step up in my role, because they saw that I had that background. But the truth is that the way that I got into even applying for this job was as a medical assistant. So they are different roles that as a medical assistant you could start with that. So what is a data entry is the most basic level at the research part. Is basically a person that would just, for any type of research, yes, you gather information from the patient, but then in the setting of the research, there's a lot of information that you need to put in, a lot more than what you ask the patient. So for that, the data entry is really important. If you don't have any type of experience of research in your country, or even if you in here, if you have not like done any type of research at all, data entry will be a good way of starting if that's really what you want. Like I said, it's very basic. Most of the times the role that they ask is just even people with a GED, which is just finishing high school. So it means that you don't need to have any type of training for this. They will train you. And that is something very important that people like, I don't know how to do this. I don't know how to do that. I think the working in health here in the US is very good at training you. So that is something really important to do. A research assistant goes a little bit above the data assistant, which means that is the person who usually prepares the kits, calls the patients, or prepare everything for the coordinators to be able to start enrolling the patients. So I've seen medical graduates who also start in the research assistant. Actually, that's what when I first applied, that's what I applied to, which is the person who they needed to do blood draw in case it was needed. And it doesn't need much experience in the research world. once you get into the research technician, they do ask you to have a bachelor that is health related. So most of the people who start, in my case, I started as a technician, and then as time goes by in the research, as you support and you give, and you show your interest in the world, you could actually start moving up as a technician, then a specialist, and then coordinator. And most of the times the coordinator is the highest role that you could actually get in the research world, unless you want to go further in management and stuff like that, that if you want to continue with that. If you want a certification, in my case, so everybody who works in research needs the CD program certifications. That means at least for the good clinical practice and the human subject research, you need to do those courses. But in my case, and I think most of the in the cases, even if you don't have it, once you get the job, they would actually pay for you to do those types of research certifications. And there is one really good certification that takes a little bit takes you a little bit more and beyond, which is the certified clinical research professional that is taken with SOCRA, and it's kind of like a licensure, like studying for any other type of boards for the clinical research. It is not necessary to do this. Like I said, most of if you work in a university, they do encourage you to take it, and sometimes they even give you a bonus if you have this certification. They even give you other types of city programs, certifications once you become in that, but it's not necessary. I've seen that there's some programs, for instance, I've seen Harvard that has a research program for doing something similar to what you could get with SOCRA. It's not absolutely necessary for that, like to be able to work in research to have it. I work in research, I don't have it. Some of my coworkers do, because like I said, if you want to stay in research, it's good to have it because you get a bonus. But I think it's more about the experience, and once you define what it is that you want to do. If you do want to consider a fellowship, you have to know that it's a good instance if you don't have a working visa. But then again, if you're wanting to do a non-clinical, which is a basic sciences, you could get a fellowship, and you could use your fellowship as a way to actually enter for the healthcare system. If you just want to do even for a PhD or even clinical research, you could do through the fellowship, as like I said, in basic sciences. But if you want to stick with the clinical part, there are some programs that actually sponsor J1's visa. Not all of them do. Some fellowships are paid, and usually what they paid is what they pay PGY one, like a resident the first year, which is about 50,000 a year. But not all programs do. Some are non-paid, but you would actually do it because you want to get into the system. You want to learn how to analyze data, because you know how to start writing papers, publications, which a lot of people say that it's talk about in the chats and everywhere, that it's very important. But the truth is that it all depends on what kind of specialty you want to apply on. And I would say that as a fellow, the difference between the duties that you're able to do is that you'll be able to do more analysis, more clinical analysis of the cases. You would get more experience in writing and evaluating patients if you do have that clinical licensure, and you'll be able to do more presentation of posters. In my specific group, I would have to say that there's two fellowships, and for instance, one was an IMG, and what she was able to do was that she was able to write papers and analyze data and just be an observer. It was kind of like an observership being a fellowship. But the other fellow, for instance, he's an internal med from the US, and he was able to actually see patients, evaluate patients, do clinical trials, and it's a little bit more hands-on. So even in the fellowships, it would actually depend whether you're able to see patients or not. So it would be good to actually, if you're looking for a fellowship, to kind of go a little bit abroad and be able to see if whether you qualify or not before you even apply, just to see how it goes. So how do I choose what to do on these types of different choices? Well, it depends of your immigration status, because like I said, if you are not able to work in the US, then you would not be able to apply to a data entry, the research assistant, or even as a research coordinator, which is entitles and the enrollment of patients. It would also depend on your financial independency, because if the fellowship that they're offering you is non-paid, well, then you would have to be able to sustain yourself here in the U.S. without working. So it also it's sometimes that kind of is what makes you take the decision. And it also depends on your research experience and networking. Obviously, if you have a lot of research experience, even in your country, like in my case, groups take that into account. So it's not that everything you have to have is here in the US. No, you can actually have a lot of experience in your home country, and it's a good way to start the conversation, even to be acknowledged. The advantages is that if you have like with this, you'll be having direct contact with principal investigators. I would have to say that working as an MA in the clinical setting and working as a research coordinator, the academia is you can feel it more in the research world. They train you, they encourage you to actually go a little bit further. And I feel that that is a really good encouragement if you want to continue with your match process. It's an excellent way of networking. They advocate for you. If you're a good worker, then they would actually advocate for you and help you to be able to match it. In some programs, they do want fellows that actually have a very good chance to actually succeed in the match process. So they give them a better statistic. That's what they call. But I feel that the best way to actually match is to match in a program that they know you, that you've been working for them, and that you can actually get a little bit more of, they know who you are and what you stand for. I feel that you get a better chance if you apply for a program that they know you already, and you could get that working as a surgical assistant, medical assistant, or even in research. So depending if that's the specialty that you want, I would say that it gives you a good opportunity for that. The direct affiliation with the university or hospital of your preference, I would say that that is one of the things that I'm advocating the most, because for instance, I'm only applying in the hospital that I want to end up with. So I'm getting to know a lot of people in the hospital that I want to work with. I've been able to meet a lot of people that otherwise I would not be able to. Working as a research coordinator, I'm part of the Equity and Inclusion Committee of the School of Medicine for Internal Med in my university. So those are things that only once you work for them and that you are being part of that world gives you the opportunity to actually be part of that. So it's a very good opportunity for that, and it's a direct experience in the specialty. So I always recommend that try to do that in the specialty that you want to work with, and obviously publications, which is something that it's important. But like I said, it all depends on the specialty you want to. There's, especially if we're going for especially family med or internal med, some specialties, those specialties are not so savvy about that you have to have a lot of publications, depending on the university, of course. But especially because most of the programs sometimes think that if you're going into research, you're going to do it in basic science, you're going to be in a lab, you're going to do molecular stuff, but not really, because like I said, there's different types of research where you could do observational studies, you could do quality of life, you could do other types of research, and that could be actually helpful once you go into your family med or internal med. So it's not just black and white. So just give you hints of that. Tips on how to be able to become and start working in research. Well, I would say that working in MOLA and talking to as many international graduates as you can imagine, most of the most amazing experience that I've known are people who actually gather a bunch of emails from PIs who were from their home country, and they started contacting them. I've known people who've been able to work in Mayo Clinic just by doing that, just by emailing PIs. And yes, you're going to get a lot of ghosting. You're going to get a lot of people who are not going to respond to you, but maybe you're going to get 2 or 3 people who are going to answer you. And those are the kind of people who are going to be interested in helping you out. So I would say just it takes a lot. It takes a lot of emails, a lot of calls, a lot of research to actually be able to get one of these positions, but I feel it's totally worth it. And I've known successful stories about it, about the certifications and the platforms that you get to actually get through for your CV. You get a lot of platforms that are going to help you out if you want to apply to match, because in my instance, for instance, in my case, I know how to use different settings of EMRs, which is the electronic medical records from different hospitals, which are going to come in handy once I want to apply for the matching process. RedCap, which is something that they use throughout the nation for research, and different types of even like different regulations and stuff that are going to help you a lot. So I feel that it's very helpful for that. And how to get into that is just apply, and apply. Like I said, it's I applied several times. I would say probably to 20, 30 programs that I wanted to work in the same university, because I was decided that I wanted to be in that university, and applied to very diverse research groups until one actually gave me the opportunity, and that's the reason why I became an MA, to actually be able to enter that world. And as an MA, I applied, and I found a group that not only gave me the opportunity as an MA, but they actually acknowledged all the other knowledge that I had as a physician, and they're helping me to actually move up, and they're giving me opportunity to study, and they're giving me like I have mentors inside of my group to actually that are helping me to take my steps and stuff like that. So it's something that you could actually gather through working hard, and through a good research group, and it's something that you could actually do throughout this whole process. So another thing is that I passed from working fully in campus until working remote, and because they're giving me opportunity to work to be able to study. So that's something that you will be able to do it more in research, that if you're working in the hospital. So that's another good part of that. And the research part, depending on the type of research that you do, it gives you patient contact, and it also gives you opportunity to talk to patients, and it gives you opportunity to practice your English, and it gives you opportunity to actually be in the hospital with real patients in the real world. So, and it gives you the opportunity to be on very like top and novel things to be able to work at. So I would say it's totally worth it. So coming back to this, now that we know what each one of them do, like I said, it's different. If you work in the US, you'll be able to be employed and get paid for that. Clinical, as a nurse, you could be a research coordinator, or non-clinical, you could do any of these types of roles. Starting in research technician, you enroll patients and you get to see patients. But like I said, and you could actually make a living with this. So it doesn't have to necessarily be people who want to just do this because they want to do the match. People who actually, if you want to do something for a living, you could stay in this. And if you're not able to work in the US, you could actually go through this other part, which is through fellowships. And that's pretty much something very simple and like just superficial about what research is. Please remember to check us out in the Chicago MOLA website. We are right here on the programs. ISG stands for International Health Graduate Program. And please remember the survey. Melissa, our fellow, is telling us and is sending it through the link that please do the survey throughout the whole process, through the questions and anything. You could actually do the survey, and that is the way for us to know who came, who's interested, and what other topics you want to know. Thank you, Miguel, and thank you everybody for being here with us. And now let's open up for the questions. Miguel, thank you for moderating today. That is it for me. Thank you.
Thank you, Dr. Castaño. I appreciate it. Well, the floor is open up for questions. If you have any question, please type in the chat box. Or if you want to raise your hand up, go ahead. So I'm not seeing any question, but I have a question
I
there.
think we have answered all the questions.
Yeah,
The
you
chat.
guys did a great
Yeah,
job.
we're very active in the chat.
Well, this is I think that Janet can help us here. Does research help you for your match in the hospital you are working?
So I am not in the matching process yet. I still have some tests to do, but I've met so many people, and I feel that my networking is so strong that I feel that I'm gonna do everything it takes for me to be able to. Hopefully, in the coming years, I'll be able to be in the position that Adelis is at. But I have to say that the fellows that have come into the group that I'm at, they have matched, both of them. There's two fellows, all the fellows that changed, they do match. And even another fellow, like another international medical graduate that started with me, he's from India, and he came, he's just started as a data entry he matched, and he's gonna leave this May to go. And one thing that he said is that within the group, they helped him so much. They helped him to get interviews. They helped him to actually be able to, even one of the fellows helped him to help with his CV, to actually put it in together, to correct it, or Supreme Director, which is the doctor who is like the group director, gave him a letter of recommendation. And I have to say, he's one of the most known persons in the GI world in the United States. And he even says with that letter, he jumped into the many interviews because of that letter. So and the only way for us to get to know those kind of people is by working with them, is by working in the research world. And it's not, I don't feel that I would be able to get to know a person this well known in the medical field if it wasn't for that. So I am blessed for that. I'm grateful, and hopefully I'll be able to match, hopefully, but I'm not in that process yet. But I do feel that it's a strong background that gives you if you're in that position.
Thank you, Dr. Castaño. Pretty precise. I see that Francis Guerra is raising her hand up.
Yes, good evening,
Good
Janet.
evening, go ahead.
Muchísimas gracias por organizar esta conferencia, esta reunión. Estoy muy contenta de ver la iniciativa del grupo de MOLA en específico. I feel that, for us Latin Americans coming to the US for XY reason and trying to move into the medical field, whatever you want to do, is hard. And one thing that definitely Janet Hammer and, put in the point is, when you're matching, every program has the rubric as how they score you. And research is so much important nowadays as a predictor of your abilities to, hone clinical skills, to produce more knowledge in the future. So many residency programs look at that and give you a lot of points on that note. The other thing that I want to stress out is the fact that we have the ability to speak Spanish and English. And for all of you who do feel like, my pronunciation and spelling, it's not the best, just jump in. Nobody's perfect. And I feel that you have to take pride of having an accent, because it means that not only you're capable to speak more than one language, but also you're brave enough to translate your experience here, which is valuable. So don't feel shy on that note. Just keep practicing and move on. And the other thing that I want to is that, with no offense to any other group, I see what other groups from other countries do, from Asia, Europe. Those groups gather together, they support each other. And I feel we are so many. We are the fastest growing minority in this country. We really need to support each other. We really need to vouch for each other and try to move into this, and not just, cutting cuts or making other lives difficult. So we have to stick together and try to move together in this thing. So thank you so much, you guys, for organizing this. I'm extremely proud of the work that is being done in here. And if anything, just let me know how can I help. I'll be more than happy to that. And Janet, mucho gusto de verte de nuevo.
I know, Francis, muchas gracias.
Thank you.
Yo solamente voy a compartir algo. I just wanted to show this quick picture right here. This is Dr. Francis. It's so good to see you again. This is MOLA's webpage. So it's so good to see you, Dr. Francis. And yes, you're totally welcome to MOLA. Everybody, if any of the people who are here are interested in helping us out, we're having our committee the first Wednesday of each month. So just shoot us an email. It could be either to Adelis, to me, or to Miguel, who's the incoming co-chair, and we'll be more than happy to have all your inputs. And oh my God, it's so good to see you, Francis, again. Thank you.
Un abrazo, Janet.
Lo mismo. Ciao.
Muchas gracias. Thank you very much, Dr. Guerra. We appreciate your participation here. I see that Diana wants to talk. Please go ahead.
Yes, I just want to say thank you. I think the information is very good. And as she said, you know, when you are an international medical graduate, sometimes it's difficult to find information that is good and that really help you to navigate this, you know, process of getting your certification and being able to practice in the United States. So it's really valuable idea, and I really like it, the group.
Thank you. Thank you very much.
Thank you very much. Well, we are about to end right now, but I want to open up the mic for Mr. Hurtado to talk about recent news that I saw in a website in Florida about fraud RN programs. I don't know if you have 1 minute to talk about that right now. I don't know. You can help us.
Absolutely. As you guys already know, the easy way is not the way, man. I mean, the easy pathway is going to be tempting. You got to hold on tight. You got to hold on and do the proper channels. It's, you know, the 7,600 fake nurses. I can't wait to see what the consequences are going to be for those who paid for it. And not to say that is not, you know, the nurse's fault or, you know, or doctor's fault, whoever paid for it, because they're part of it too. But I understand being desperate. You know, I understand that sometimes we're desperate and such an easy opportunity comes along and we believe, oh, we can do that job and it's legit. No, it's not legit. I mean, somebody asked me, can we do a program 100% remotely? No, you can't. And it is not a matter of you don't know what you're doing because nursing knows more. It's a matter of it's a system. It's already created. You're not changing it. So it's already created. You need to go through you need to follow each step. You need to do A, B, and C in order to obtain D. And because nursing is so specific, yes, it may be simple, but as simple as nursing theory, that was not taught in medical school. Is it going to make you a better nurse? No, hell no. I'm sorry, my English, but it's not going to make you a better nurse, but it's a step that you need to accomplish. And then the clinicals part of it, you have to do it. Luis, Puerto Rico has a program, but it's not 100% remote. It is 90% remote. It's 10 months that you do online and then 2 months that you have to do clinical. So my call here is you have to be careful with universities that tell you, oh, you don't have to study, or universities that tell you, here, pay me this and I'll just issue you the diploma and then you'll take the NCLEX. Because all those 7,600 nurses who are working out there, if they got the green card through nursing, most likely they're going to lose it. Most likely their family is going to lose it. Most likely they're going to go to jail. So it's better to just do things properly to the proper channels and not fall into temptation. And like what Ikuku was saying and Dr. Arias, it is very important to invest in yourself. We are not a culture that we tend to pay other people to teach us. We don't pay for knowledge. We don't pay for, oh, I can just find it online. Most likely you're gonna make a mistake. You have to invest into conferences, into groups, into organizations that have already walked that path and can just save you a ton of time and a ton of money by telling you what not to do. You pay somebody and they'll be able to tell you, this is the mistake I made. You don't make it. So that is kind of my advice, Miguel, as far as you know, programs that are fake or seem too easy. Just do your research and find a consultant that knows about the topic, and then maybe invest the money or go to conferences like these that are for free, and it's a great resource to get more information. Hope that helped.
If I can, I would also like to talk about that topic, and is that there's plenty of accelerated nursing courses that you could actually take once you have your bachelor's. And in that case, we have the physician bachelor, so we can apply to the accelerated programs that are from recognized universities. Most of them take 16 months to be able to be a registered nurse with the bachelor. That would be able to allow you to continue with your medical education as a nurse practitioner. And if you work, in my instance, since I'm working in research, I'm affiliated with the university, I have the opportunity to actually have, like, the university would pay for a certain part of that process. So that's another advantage that you could have from working in the university. And because we have done our previous background, we could actually get a bunch of credits that are going to be accepted as a prerequisites. There's some
Absolutely.
universities that need you that have like certain deadlines that they can't be more than 10 years after you're taking the courses. Some other universities you could actually, like, they don't have a time limit for that. University
Right.
Indiana is one of those that you don't have a time limit. You go through international affairs, they accept you as a transfer student, and you would actually have to do just very simple prerequisites, probably 2 to 3 classes, and then you'll be able to apply to that accelerator program. And with that, you'll be able to continue with that process. And even for the surgical assistants, I'm sorry, I saw that in Indiana, they are searching for surgical assistants, and they're even giving bonus. So it all depends on different states, different places, and there are shortage in different parts. So if you are one of those persons who you don't like, there's nothing that is attaching you in certain state or other, you could always look to different states, because it is different. And in some places you could actually get bonuses if you sign as a nurse, if you sign as a surgical assistant, if you sign a certain things that are in shortage, you could get a lot of good offers from that.
So yeah, and Jenna, thank you for adding that. So you guys understand, you do not have to study again. You can go to a program that is going to be shorter, it's going to be faster and cheaper. It's just a lot of homework, because like she said, there are a lot of laws involved, and each state depends. And one of the goals that we have at AMP is we're creating a university that our goal is to be the fastest and the cheapest in the whole market. And there are opportunities out there. You just have to study them. And like she said, depending on when you work, like HCA, for example, they own their own university. And usually when you work for them, they pay for part of your schooling. They don't have an accelerated MD to RN program. However, if you were to do their bachelor, you were to do a bachelor's degree in any of these programs, and then you work for HCA, then you can do your master's in nursing through HCA for free. So it all depends on where you work, where you live, but you have to do your homework. You have to sit down, write things down, organize enough, and say, what is the most convenient to my current situation, financially, emotionally, and is it close to your house? Is it not close to your house? Can you afford it? Can you not? We're eventually going to partner up with a company, just so you know, guys, FYI, that if you are not in the United States and you have a bachelor's in any sort of field, you can come under an F1 student visa, which is an international student visa. And it's not going to be a scholarship that it's for free, but they can get you loans and they can get you the money through a bank entity. And it is really, really hard for an international individual to get a loan in the United States. I tried so many different routes to get scholarships and loans, and it was so hard. But I had a great meeting yesterday with a company that's all they do. They help international students who have a bachelor's. And I told them, hey, I got a ton of doctors who would be willing to come here and do an F1 student status to then nursing and then nurse practitioner. And so we're talking, it's something that, it might be in the process to eventually we might launch, but keep your eyes open, because opportunities are going to be there. So especially if you are somewhere else in the country, and then keep this in mind, becoming a nurse doesn't mean that you're going to quit to your dream of matching. A lot of medical doctors become a nurse. That's their ticket to get in. That's a green card pathway to stay here. And then, some of them decide to still do the match and, step 1, 2, 3, and then the match. So there are opportunities. We just have to do the homework.
And the other thing is that many programs consider medical assistant, surgical assistant, nursing, and any other field that you get into the healthcare and you get contact with patients, they consider it a hands-on experience. That's even one of the reasons why, even though working as a research coordinator, I still do some MA duties in the university hospital that I'm at, because that is considered hands-on opportunity. My suggestion for anybody who's coming in, who has the opportunity to work, even while you're doing your steps and you're studying, try to give yourself a chance to get to know the healthcare system from within, because it's going to give you a knowledge that you might not be able to experience any otherwise. Observerships and hands-on experiences sometimes are very expensive to get into. We are giving you today an opportunity to just explore different options as a career, but even if you are wanting to match, as it's helped Adelis, it's helped Dr. Guaracuco, it's actually has given them an opportunity to meet people, to be able to experience and to get the health care system to know within, because it's so different than from our home countries, that it's good to actually have that experience. And even when we start talking about different letters, MP, PA, this, MA, we don't know what that means once we come into from our home country. So even to get to know that is something that you're gonna get to know once you get into a healthcare system. So if you're able to, I would certainly encourage you, because it does give a different perspective.
Okay, thanks for your insights and your advice. Okay, I think that we are done here. I want to thank all our panelists, and I want to thank all of you who have joined us today. Don't forget to join MOLA. We are waiting for you at the IHG committee, and I wish you all of the best in your career journey. And please join MOLA, visit our website, and we'll be happy to have you, all of you. Thank you.
Thank you. Thank you, Miguel. Thank you, everybody.
Thank you very much.
Gracias a
you.
todos. Feliz noche.
Thank you, everybody. Thank
Feliz
you.
noche.
Have a good night.
Gracias.
Bye-bye.
I hope the information was helpful for some of you.
Thanks.